Hi, I want to speak to you about how patients with COVID or suspected COVID or their family and friends can help to monitor their health when they're not in the hospital. In other words, when they're at home. One of the challenges with the high number of diagnoses of COVID or suspected COVID is that hospitals and medical centers just don't have the capacity to admit every case. In some cases, patients with mild to moderate symptoms are being triaged to home to make way for those who have more severe features of the disease. This is understandable, but it's unfortunate because many of these patients don't have the resources, they don't have the know how, they don't have family and friends around them because of social distancing to help them monitor their health, to keep an eye on what's going on. In many cases, these individuals can quickly progress to more severe, more serious symptoms. So, what are the things that can be done to monitor health in the home? There are, of course, several features of COVID. One of the most significant is breathing difficulties. With that symptom, it means that the oxygen levels can go down. And when that happens, it leads to a condition referred to as hypoxemia or hypoxia. That simply means that the tissues and organs don't have enough oxygen to function in an optimal manner. And that is precisely what patients with COVID do not want because their system is already compromised. So, what can be done? Well, fortunately, there is an inexpensive and relatively simple, easy way to monitor breathing and oxygen levels in the home. And that is using a device referred to as a pulse oximeter. And I have one here. Okay, so how do you use a pulse oximeter? Well, the first thing to do is to use alcohol prep pads to clean the device, especially the inside, where you'll place your finger to take the measurement. And then, of course, you want to clean your finger before you place it into the device for the reading. I'll turn it on by pressing the button on the front, and then you open it like this and place your finger inside. There's a light that goes through your finger, and that light measures the amount of oxygen that's in your blood in your finger. I should warn you that if you have nail polish, then it doesn't work so well. If you have false nails, it doesn't work so well. So you will see a number of readings. There are two readings that you should pay attention to. The one at the top is the one that we're really interested in, which is your oxygen saturation level. And then there's another reading below, which is your pulse rate. The number that is flashing, 99, shows my current oxygen saturation. In a normal, healthy person, the reading should be somewhere between 95 and 100%. But with people who have breathing difficulties, the number can be significantly lower than that. Oxygen saturation falls below 95%, so you're in the 94, 93, 92% range, then there are reasons to be concerned because you may have a medical emergency or a developing emergency that requires immediate attention, or it may not be. But either way, it's important that your oxygen saturation is increased back to normal range. There are a number of ways to do that. If you're on prescription oxygen, then of course you have to take that as prescribed. Alternatively, you may just need to open the window so that fresh air can enter the room. Sometimes you may need to reposition yourself so that it's easier for you to breathe. But either way, it's important that you reach out to your care provider to have a discussion about your current medical status and take appropriate advice on what next steps to take. But if the number falls below 91, 90%, then you have a real medical emergency because at those low rates of oxygen saturation, your tissues and your organs are not getting enough oxygen so that they can function in an efficient way. And that is precisely what people with COVID do not want because they are already compromised. And so that can have a profound effect on how they feel and how they function and their state of general health. If that should happen, you should call 911 immediately if your oxygen levels falls to 91, 90% or even less than that. These devices, they're not expensive. They can be had by just purchasing from commercial sources. You don't need a prescription. It's good to have them. If you don't, then perhaps ask a friend, ask a family member, even your healthcare provider. You might ask if they can provide you with one of these if you don't have one. In the meantime, folks, I wish that you will remain safe, you will stay in good health, and take care of yourself and take care of each other.